talk about, as you can see, these products, warts. Remember, if you're not a patient with Westwood-Mansfield Pediatrics, if your pediatrician has a different opinion, please talk to your pediatrician. Warts are a virus that oftentimes develop into little masses of skin called warts on the hands and the soles of the feet, sometimes on the knees, occasionally on the face, oftentimes not on the rest of the body. Now, they are caused by a virus, a papillomavirus, and they will go away generally within 2 to 4 years, about 70% of the time. These medicines, while I don't endorse any specific medicine at all, are the ones used most frequently. Remember, anything you do is about 50% effective, and tincture of time, this will go away. Now, what I want to show you here is the different types of things. Something parents oftentimes don't do is use a nail file or an emery board. It's very important that people file down the wart. First, we suggest, and again, there are many different ways of doing this, using the wart remover here or this. This is usually much cheaper. Take the emery board, soak this every day, and file it, then apply one of these two things, okay? It's a salicylic acid. Then after you file down so it's very close to the skin, and these are the warts on the hands oftentimes, you can then use the freeze off and freeze it the rest of the way. Again, anything we do is about 50, maybe with this 60-70% effective, although there's no good studies on that. So, and remember, the emery board or the nail file is very important to use regularly with this. A wart looks like a little heap of skin. Almost when you look at it, it looks like it's pedaling when you take a magnifying glass and look at it. And oftentimes there are black dots in it. It is not highly contagious from person to person. Maybe slightly contagious, but not highly. So you shake somebody's hand, you're not going to get it. It's very unusual. Now, warts on the feet, plantar warts, may be different, and sometimes you have to go to the freeze-off because those warts may not heap up. Now, the key thing about using freeze-off is if you use it in the middle of a season with a sport, it may limit their ability to play the sports for a little while. Occasionally, these things can blister with it. The other thing is occasionally they can get infected after using this, which would be a real red ring around the wart and very tender. That's very rare, but occasionally can happen. And remember, when you apply these medicines, try to apply it as much on the wart and avoid the other place as much as possible, because that can create problems as far as irritating the skin, and sometimes you have to stop using it. Again, use these two medicines for about 1 to 2 weeks on the hands and like on the knees, and then use the freeze off while using the nail file while using one of these two products. Thank you very much. This is Dr. Lester Hartman from Westwood-Mansfield Pediatrics, proactive in your child's care, caring for families for over 30 years. Thank you.